Hello, and welcome to Political Common Sense for America. I'm Brian Boeheim, the political engineer. And in this 3-minute video, I want to talk about the paradigm shift that needs to occur around health insurance. In a previous video, we talked about the idea that we need 3 things to happen. We need tort reform, we need to lower regulations for interstate competition around health insurance, and finally we need to deal with the illegal immigration problem because it sucks so much money out of our healthcare system. But the biggest thing we need to do is we need to break the link between our employer and our health insurer. See, the reality is that the idea of your health insurance coming from your employer started in the Franklin Delano Roosevelt days. And it was done in concert with unions to try to keep you tied to one individual company for your life. The reality is that our world doesn't work like that anymore. We change jobs. We don't stay with the same company for 35 or 40 years. And so we need a different model. Now, I know right away people are going to say, wait, Brian, but it costs so much more to buy your health insurance individually. Well, that's propaganda. Because the reality is, it doesn't. When your company goes and tries to buy health insurance, the common belief is that they have 300, 400,000 people so they can negotiate a better rate. But in reality, what happens is the health insurer looks at those 300, 400,000 people and it looks at the risk levels. And then it takes the highest common denominator and that's what it charges each individual. And believe me, they're charging each individual because it's coming out of your paycheck. It's just coming out before you realize it. So it's reducing your compensation. And oh, by the way, you've gotten raises in the last few years. You just haven't seen it in your pocket because it has gone into your health care. And this is part of the problem. In our method, in our system, you'd get paid by your employer a greater compensation. You'd get it in cash. It would then give you the opportunity to go out and buy on an open market general care, emergency care, and major medical. They would be separate policies, and as a matter of fact, most people would probably just buy major medical and possibly emergency care, but they would pay for their general practitioner and their general care separately out of pocket. And the cool thing about this is it will bring you and your doctor closer together. You no longer will you have an insurer or the government telling you what you can and what you can't do in terms of your health care. That's our idea on how to break this health insurance challenge and to change the paradigm.